been 1 year of launching Elite Expertise, and we've helped more than 300 students in clearing CAPS exam in their very first attempt with the same enthusiasm and the same goal to impart high quality, affordable pharmacist professional education to overseas pharmacists who are looking to migrate to developed world and to enrich and explore their practice overseas. We are starting a PEBC preparatory course on 28th July 2024. All of you kindly mark the date. It's going to be with the same enthusiasm, same quality education, same highly expertise practice knowledge imparted to our students with high clinical skills and expertise to enable you clear your previous exam in the first attempt. Well, we all welcome you to the platform Elite Expertise. Stay tuned to Elite Expertise for more updates. Thank you.
Hello, are you an overseas pharmacist wondering if there is an age limit to become a registered pharmacist in Canada? The answer is no. There is no age requirement to become a registered pharmacist in Canada. However, you must meet the educational and licensing requirements. If you are looking to build your career in pharmacy, focus on finishing your qualifications and licensing requirements. If you have any other questions, feel free to contact Elite Expertise. Thank you.
നിങ്ങൾ നിങ്ങളുടെ ഫാർമസി കരിയർ കാനഡയിൽ സ്വപ്നം കാണുന്നുണ്ടോ? എങ്കിൽ നിങ്ങൾക്ക് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ PEBC കോച്ചിങ്ങിൽ ചേരാവുന്നതാണ്. എന്തുകൊണ്ട് എലൈറ്റ് എക്സ്പെർട്ടൈസ്? മികച്ച നിലവാരമുള്ള ടീച്ചേഴ്സ്, കൃത്യ ഇടവേളകളിലുള്ള മോക്ക് ടെസ്റ്റ് എന്നിവയാണ് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ പ്രത്യേകത. അതുകൂടാതെ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ ഡയറക്ടേഴ്സായ മിസ്റ്റർ ആരിഫ് മുഹമ്മദ്, മിസിസ് ഹാരികയുമാണ്. ഇവർ രണ്ടുപേരും ഓസ്ട്രേലിയയിൽ ക്ലിനിക്കൽ ഫാർമസിസ്റ്റായി വർക്ക് ചെയ്യുന്നവരാണ്. ഇപ്പോൾ തന്നെ നിങ്ങൾ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ 20 ജൂലൈയിൽ കാനഡ PEBC ബാച്ചിൽ ജോയിൻ ചെയ്ത് നിങ്ങളുടെ കാനഡ സ്വപ്നം ഞങ്ങളിലൂടെ പൂർത്തീകരിക്കും. നിങ്ങളുടെ കാനഡ സ്വപ്നം ഞങ്ങളിലൂടെ പൂർത്തീകരിക്കും.
It has been 1 year of launching Elite Expertise, and we've helped more than 300 students in clearing CAPS exam in their very first attempt with the same enthusiasm and the same goal to impart high quality, affordable pharmacist professional education to overseas pharmacists who are looking to migrate to developed world and to enrich and explore their practice overseas. We are starting a PEBC preparatory course on 28th July 2024. All of you kindly mark the date. It's going to be with the same enthusiasm, same quality education, same highly expertise practice knowledge imparted to our students with high clinical skills and expertise to enable you clear your previous exam in the first attempt. Well, we all welcome you to the platform Elite Expertise. Stay tuned to Elite Expertise for more updates. Thank you.
Hello, are you an overseas pharmacist wondering if there is an age limit to become a registered pharmacist in Canada? The answer is no. There is no age requirement to become a registered pharmacist in Canada. However, you must meet the educational and licensing requirements. If you are looking to build your career in pharmacy, focus on finishing your qualifications and licensing requirements. If you have any other questions, feel free to contact Elite Expertise. Thank you.
നിങ്ങൾ നിങ്ങളുടെ ഫാർമസി കരിയർ കാനഡയിൽ സ്വപ്നം കാണുന്നുണ്ടോ? എങ്കിൽ നിങ്ങൾക്ക് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ PEBC കോച്ചിങ്ങിൽ ചേരാവുന്നതാണ്. എന്തുകൊണ്ട് എലൈറ്റ് എക്സ്പെർട്ടൈസ്? മികച്ച നിലവാരമുള്ള ടീച്ചേഴ്സ്, കൃത്യ ഇടവേളകളിലുള്ള മോക്ക് ടെസ്റ്റ് എന്നിവയാണ് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ പ്രത്യേകത. അതുകൂടാതെ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ ഡയറക്ടേഴ്സായ മിസ്റ്റർ ആരിഫ് മുഹമ്മദ്, മിസിസ് ഹാരികയുമാണ്. ഇവർ രണ്ടുപേരും ഓസ്ട്രേലിയയിൽ ക്ലിനിക്കൽ ഫാർമസിസ്റ്റായി വർക്ക് ചെയ്യുന്നവരാണ്. ഇപ്പോൾ തന്നെ നിങ്ങൾ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ 20 ജൂലൈയിൽ കാനഡ PEBC ബാച്ചിൽ ജോയിൻ ചെയ്ത് നിങ്ങളുടെ കാനഡ സ്വപ്നം ഞങ്ങളിലൂടെ പൂർത്തീകരിക്കും.
expertise, and we've helped more than 300 students in clearing CAPS exam in their very first attempt with the same enthusiasm and the same goal to impart high quality, affordable pharmacist professional education to overseas pharmacists who are looking to migrate to developed world and to enrich and explore their practice overseas. We are starting a PEBC preparatory course on 28th July 2024. All of you kindly mark the date. It's going to be with the same enthusiasm, same quality education, same highly expertise practice, knowledge imparted to our students with high clinical skills and expertise to enable you clear your previous exam in the first attempt. Well, we all welcome you to the platform Elite Expertise. Stay tuned to Elite Expertise for more updates. Thank you.
Hello, are you an overseas pharmacist wondering if there is an age limit to become a registered pharmacist in Canada? The answer is no. There is no age requirement to become a registered pharmacist in Canada. However, you must meet the educational and licensing requirements. If you are looking to build your career in pharmacy, focus on finishing your qualifications and licensing requirements. If you have any other questions, feel free to contact Elite Expertise. Thank you.
നിങ്ങൾ നിങ്ങളുടെ ഫാർമസി കരിയർ കാനഡയിൽ സ്വപ്നം കാണുന്നുണ്ടോ? എങ്കിൽ നിങ്ങൾക്ക് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ PEBC കോച്ചിങ്ങിൽ ചേരാവുന്നതാണ്. എന്തുകൊണ്ട് എലൈറ്റ് എക്സ്പെർട്ടൈസ്? മികച്ച നിലവാരമുള്ള ടീച്ചേഴ്സ്, കൃത്യ ഇടവേളകളിലുള്ള മോക്ക് ടെസ്റ്റ് എന്നിവയാണ് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ പ്രത്യേകത. അതുകൂടാതെ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ ഡയറക്ടേഴ്സായ മിസ്റ്റർ ആരിഫ് മുഹമ്മദ്, മിസിസ് ഹാരികയുമാണ്. ഇവർ രണ്ടുപേരും ഓസ്ട്രേലിയയിൽ ക്ലിനിക്കൽ ഫാർമസിസ്റ്റായി വർക്ക് ചെയ്യുന്നവരാണ്. ഇപ്പോൾ തന്നെ നിങ്ങൾ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ 20 ജൂലൈ കാനഡ PEBC ബാച്ചിൽ ജോയിൻ ചെയ്ത് നിങ്ങളുടെ കാനഡ സ്വപ്നം ഞങ്ങളിലൂടെ പൂർത്തീകരിക്കും.
Launching Elite Expertise, and we've helped more than 300 students in clearing CAPS exam in their very first attempt with the same enthusiasm and the same goal to impart high quality, affordable pharmacist professional education to overseas pharmacists who are looking to migrate to developed world and to enrich and explore their practice overseas. We are starting a PEBC preparatory course on 28th July 2024. All of you kindly mark the date. It's going to be with the same enthusiasm, same quality education, same highly expertise practice, knowledge imparted to our students with high clinical skills and expertise to enable you clear your previous exam in the first attempt. Well, we all welcome you to the platform Elite Expertise. Stay tuned to Elite Expertise for more updates. Thank you.
Hello, are you an overseas pharmacist wondering if there is an age limit to become a registered pharmacist in Canada? The answer is no. There is no age requirement to become a registered pharmacist in Canada. However, you must meet the educational and licensing requirements. If you are looking to build your career in pharmacy, focus on finishing your qualifications and licensing requirements. If you have any other questions, feel free to contact Elite Expertise. Thank you.
നിങ്ങൾ നിങ്ങളുടെ ഫാർമസി കരിയർ കാനഡയിൽ സ്വപ്നം കാണുന്നുണ്ടോ? എങ്കിൽ നിങ്ങൾക്ക് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ PEBC കോച്ചിങ്ങിൽ ചേരാവുന്നതാണ്. എന്തുകൊണ്ട് എലൈറ്റ് എക്സ്പെർട്ടൈസ്? മികച്ച നിലവാരമുള്ള ടീച്ചേഴ്സ്, കൃത്യ ഇടവേളകളിലുള്ള മോക്ക് ടെസ്റ്റ് എന്നിവയാണ് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ പ്രത്യേകത. അതുകൂടാതെ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ ഡയറക്ടേഴ്സായ മിസ്റ്റർ ആരിഫ് മുഹമ്മദ്, മിസിസ് ഹാരികയുമാണ്. ഇവർ രണ്ടുപേരും ഓസ്ട്രേലിയയിൽ ക്ലിനിക്കൽ ഫാർമസിസ്റ്റായി വർക്ക് ചെയ്യുന്നവരാണ്. ഇപ്പോൾ തന്നെ നിങ്ങൾ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ 20 ജൂലൈ കാനഡ PEBC ബാച്ചിൽ ജോയിൻ ചെയ്ത് നിങ്ങളുടെ കാനഡ സ്വപ്നം ഞങ്ങളിലൂടെ പൂർത്തീകരിക്കും.
launching elite expertise, and we've helped more than 300 students in clearing CAPS exam in their very first attempt with the same enthusiasm and the same goal to impart high quality, affordable pharmacist professional education to overseas pharmacists who are looking to migrate to developed world and to enrich and explore their practice overseas. We are starting the PEBC preparatory course on 20th July 2024. All of you kindly mark the date. It's going to be with the same enthusiasm, same quality education, same highly expertise practice, knowledge imparted to our students with high clinical skills and expertise to enable you clear your previous exam in the first attempt. Well, we all welcome you to the platform Elite Expertise. Stay tuned to Elite Expertise for more updates. Thank you.
Hello, are you an overseas pharmacist wondering if there's an age limit to become a registered pharmacist in Canada? The answer is no. There is no age requirement to become a registered pharmacist in Canada. However, you must meet the educational and licensing requirements. If you're looking to build your career in pharmacy, focus on finishing your qualifications and licensing requirements. If you have any other questions, feel free to contact Elite Expertise. Thank you.
നിങ്ങൾ നിങ്ങളുടെ ഫാർമസി കരിയർ കാനഡയിൽ സ്വപ്നം കാണുന്നുണ്ടോ? എങ്കിൽ നിങ്ങൾക്ക് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ PEBC കോച്ചിങ്ങിൽ ചേരാവുന്നതാണ്. എന്തുകൊണ്ട് എലൈറ്റ് എക്സ്പെർട്ടൈസ്? മികച്ച നിലവാരമുള്ള ടീച്ചേഴ്സ്, കൃത്യ ഇടവേളകളിലുള്ള മോക്ക് ടെസ്റ്റ് എന്നിവയാണ് എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ പ്രത്യേകത. അതുകൂടാതെ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ ഡയറക്ടേഴ്സായ മിസ്റ്റർ ആരിഫ് മുഹമ്മദ്, മിസിസ് ഹാരികയുമാണ്. ഇവർ രണ്ടുപേരും ഓസ്ട്രേലിയയിൽ ക്ലിനിക്കൽ ഫാർമസിസ്റ്റായി വർക്ക് ചെയ്യുന്നവരാണ്. ഇപ്പോൾ തന്നെ നിങ്ങൾ എലൈറ്റ് എക്സ്പെർട്ടൈസിന്റെ 20 ജൂലൈയിൽ കാനഡ PEBC ബാച്ചിൽ ജോയിൻ ചെയ്ത് നിങ്ങളുടെ കാനഡ സ്വപ്നം ഞങ്ങളിലൂടെ പൂർത്തീകരിക്കും.
Launching elite expertise, and we've helped more than 300 students in clearing CAPS exam in their very first attempt with the same enthusiasm and the same goal to impart high quality, affordable pharmacist professional education to overseas pharmacists who are looking to migrate to developed world and to enrich and explore their practice overseas. We are starting the PEBC preparatory course on 20th July 2024. All of you kindly mark the date. It's going to be with the same enthusiasm, same quality education, same highly expertise practice, knowledge imparted to our students with high clinical skills and expertise to enable you clear your previous exam in the first attempt. Well, we all welcome you to the platform Elite Expertise. Stay tuned to Elite Expertise for more updates. Thank you.
Hello, are you an overseas pharmacist wondering if there's an age limit to become a registered pharmacist in Canada? The answer is no. There is no age requirement to become a registered pharmacist in Canada. However, you must meet the educational and licensing requirements. If you're looking to build your career in pharmacy, focus on finishing your qualifications and licensing requirements. If you have any other questions, feel free to contact Elite Expertise. Thank you.
നിങ്ങൾ നിങ്ങളുടെ ഫാർമസി കരിയർ കാനഡയിൽ സ്വപ്നം കാണുന്നുണ്ടോ? എങ്കിൽ നിങ്ങൾ
A warm welcome to distinguished pharmacists present over here. Good morning actually it's good afternoon in India and good morning for the Canadian pharmacists. We have many of our students like Jasprit Kaur, who is from India, or just Elizabeth from Australia, from Canada. We have many students who have joined the course, and we have many live pharmacists who are watching this. So, I'm Ashrita, working as an admin manager of Elite Expertise. Elite Expertise. Just a second. Sorry for the technical glitch. As I've mentioned before, I'm Ashrita, working as an admin manager of Elite Expertise. Elite Expertise is an online education platform which is founded by Arif Sir and Harika ma'am, who are working clinical pharmacists in Australia, who have more than 10 years of experience. And they're basically from India and a place called as Hyderabad. They've started their career as for teaching the students in the profession of teachers. After that, they have started again the career. They've reframed the career to the clinical pharmacist, and they're serving the patients as well. We have been in the system for more than 2 years, and this is the course we have launched recently for helping the Canadian pharmacists to break down their career into Canada. So this course is designed, PEBC, it's a course. Today is the launch day for the PEBC. We have already the students are enrolled for the course, and this will be the first day of the orientation. We have Arif sir and Harika ma'am, who are directors of a company, on board as well. And coming to the course, the course is designed in such a way that it's designed for 6 long months. It's a comprehensive course. As you know, PEBC exam is the toughest examination. To give a base, to give a strong foundation, Sir and Ma'am have designed the course in 6 months so that they would be getting a strong basement for the future as well. As of now, we are providing this, but post January, we'll be providing for the MCQ and OSCE. So, not to go further ado, we are inviting Arif sir, director sir, to continue session. Sir, could we have you, please? Hello,
Thank you
Arif
so
sir. How was your day?
Hi. It's going well. First of all, thank you so much, Ashrita. And
Thank you, sir. Here, sir.
I would like to invite, I'm so glad to announce that today is the orientation session for the Canadian PBC exam, that is PBC preparation. And first of all, I would like to thank everyone for watching this live session, which is going on YouTube. And in case if you have any queries regarding the PBC and how the exam pattern it will be, so we are here to help you out in answering your queries and so on.
Yeah.
So, well, I would like to share a few things with you guys in this orientation session. First of all, I would like to share about who we are, Elite Expertise, and so on. And then I will go through about the Canadian PBC examination, the syllabus, and how the examination pattern it will be. Okay. So for that, I would like to share a few of my slides with you.
Yes, sir.
So I hope everyone can see this slide.
Yes, sir, we can see.
Okay, thank you so much. So, well, today I'm glad to announce that we are launching the PBC training program for the evaluation examination, which is the first part of the licensing examination for Canada. So we at Elite Expertise, we have started the Elite Expertise back in 2023 with the Australian CAPS examination training. So we have been providing the CAPS examination training for the last 1 year. And the success rate for the Australian CAPS examination was huge, in all the batches, we got around 90 plus passing rate. And the recent 2 batches, they have got around 94% passing rate. So that's the success rate that we got in Australian licensing examination. So we also got a lot of requests from the students. They asked us to also start the training for the Canadian PEBC. So we decided to start this Canadian PEBC, but we took like almost 1 year time to start this Canadian PEBC course. So the main reason is like we have contacted, I have consulted many pharmacists in Canada, as well as there are a few pharmacists who are working here in Australia as well, like in Royal Melbourne Hospital, as well as in Monash Hospital in Melbourne. So they are basically like Canadian pharmacists, but they moved to Australia and they're practicing here. So I have consulted them regarding this PEBC program and so on. So I took the inputs from all the pharmacists who are Canadian pharmacists, and then finally we have prepared this PEBC program, and we are launching it today for our next batch of the PEBC candidates. So we are launching our PEBC, our PEBC program is for 6 months duration. The preparation course is for 6 months, so that we will be teaching each and everything to the students from the basic foundations. So we'll be teaching everything to them in detail from the basic things, so that the students, they will develop their concepts regarding each and every subjects, and then it becomes much easier for them to clear this, crack this examination. Okay. So first of all, myself, I'm Arif Mohammed, and I'm one of the directors and educator at Elite Expertise. So currently I'm working as a clinical pharmacist at Northern Health Hospital, which is in Melbourne. So I have been working as a clinical pharmacist in Australia for the last 4 years. I moved to Australia back in 2018. And after moving to Australia, I did my internship for 1 year. And after doing my internship, I started my journey in hospitals as a clinical pharmacist. So while I was working as a clinical pharmacist, like many of the students, they contacted me to help them out in clearing the Australian licensing examinations. Then we started the CAPS pathway, that is the Australian licensing examination pathway, which went well, and like 94% of passing rate, the success rate. So with the same zeal, we also started this PEBC, that is the Canadian Pharmacist Evaluating Examination, the first step for the Canadian to become a pharmacist in Canada. So we designed the program in such a way that we provide the same sort of the we are going to provide the same sort of the knowledge and same sort of the support like how we did for the CAPS students. So we are also going to do the same thing with the Canadian PEBC candidates as well, so that the candidates can easily clear their examination in their first attempt. So the goal is to make sure that the candidates, they can clear the examination in their first attempt. Okay. So here I just want to go through a few of the things in today's orientation session. So this is our website for PEBC. So it's www.eliteexpertise.com.au, and we have a separate domain especially for the PEBC preparation. And so we both are the directors of Elite Expertise. So myself, Arif Mohammed, and Ma'am Harika. So Harika, she's working as a clinical pharmacist in Monash Hospital in Melbourne. So we both have been working as a clinical pharmacist in Australia for more than 4 to 5 years. And we both are the main directors, and we both are the main educators as well. So who have designed these courses for you, and will be teaching you to clear this PEBC examination. And also we have our Canadian pharmacist with us. She's Shama. So Shama is one of the Canadian pharmacists. So she's currently a fully licensed pharmacist. She has cleared all the PEBC examinations, like both the evaluating and qualifying part 1 and OSCE, that is the part 2. So she cleared all the examinations in her first attempt. And she is one of our team members now, and she will be with us. Actually, I just want to give you a brief things about Shama. So she did her Masters of Pharmacy Practice from India, and then after doing the Masters in Pharmacy Practice back in 2016, then she moved to US, and in US she worked as a pharmacy technician. And after that, because of her husband's job, they moved to Canada. And in Canada, right now she got completely registered, and right now she's a registered pharmacist in Newfoundland, and she's also a consultant pharmacist over there. And she's also one of the main faculty member who will be involved in teaching you for this PEBC program. And so here, I just want to go through a few things regarding the PEBC syllabus so that you guys will get more awareness about how the PEBC exam pattern and the syllabus it will be, and what is the passing score for the PEBC, and what are the few other things that we need to know regarding the PEBC. So everything that I just want to explain in today's orientation session. So for that, at first we can have a overview through the PEBC syllabus. So we all know that the PEBC syllabus, like in PEBC examination, when compared to the other licensing examination, other countries' licensing examination, like even if you consider with Australian exam or UK-based exam or US-based exam, so PEBC exam, like we can say that it's a bit completely different. Okay? So because in PEBC, they will touch all the subjects that we studied in our Bachelor of Pharmacy. So what will be the subjects that we study in the Bachelor of Pharmacy? They will ask the questions from all those subjects. So all the basic subjects that we have studied will be covered in PEBC syllabus. So here is the complete syllabus of the PEBC from the official website of the PEBC. So the first part or the first component is the biomedical sciences, which carries around 15% weightage. So in biomedical sciences, we need to study about the biochemistry, molecular biology, physiology, immunology, and medical microbiology. So here, biochemistry and molecular biology and immunology. So these are the minor topics that we can say. So they won't ask much questions, but from physiology, you can expect a lot of questions, and medical microbiology as the same. So overall, like 15% weightage will be for biomedical sciences. And recently, they have changed the pattern of PEBC examination. So PEBC examination now it carries only 150 MCQs. Earlier, it was 200 MCQs, but now they have reduced it to 150 MCQs. And at the same time, earlier it was the duration was around 4.5 hours for the paper with 200 MCQs, but now they have reduced the time as well. So they made the duration to up to 3 hours. So out of 150 MCQs, the 15% weightage will be given for the basic biomedical sciences. So where biochemistry, molecular biology, physiology, immunology, and microbiology. So all these subjects will be involved, and you will be asked the questions on these subjects. Then the next component of the exam is the pharmaceutical sciences, which carries around 25% weightage. So 25% weightage will be for pharmaceutical sciences. So here in pharmaceutical sciences, the first part is the pharmaceutics and drug delivery system. So which includes the basic like physical pharmacy of all the tablets, capsules, suspensions, emulsions, ointment bases, syrups, and so on, all these things that we need to study. And pharmacokinetics and biopharmaceutics. So it plays a major role. So we can expect a lot of questions from the biopharmaceutics, and also from pharmacokinetic based calculations. So there will be few pharmacokinetic based calculations will be asked. And medicinal chemistry. So usually in PEBC, medicinal chemistry will be having a less weightage. So they will hardly ask around 3 or 4 questions from medicinal chemistry. But that too, the questions that they ask, mainly they emphasize on the stereochemistry component. So when I start teaching the chemistry part, then I will clearly explain you that what are the things that you need to emphasize from the chemistry component. Then pharmacology is the important one. So it plays the major role here. So you will expect like we can get a lot of questions from pharmacology, and this pharmacology. So actually the way of preparation, like when we start preparing for the subjects. So at Elite Expertise, we'll teach in such a way that at first we will, if it is any subject, any topic, Okay? So let's say, for instance, if it is the GIT, gastrointestinal system, or cardiovascular system, or nervous system. Okay? So for any system, at first we will explain about we'll start with the physiology component. We'll teach all the physiology component, including the pathophysiology part. Then we will teach about the pharmacology component, okay, the complete classification and the mechanism of actions, adverse effects, and so on. So all the pharmacology component will be covered, followed by therapeutics, that is applied pharmacotherapeutics. So this is how we design our course. So you will be studying the physiology integrated with pharmacology and therapeutics, applied pharmacotherapeutics. And the next part is about the toxicology and clinical toxicology, and finally in pharmaceutical sciences, biotechnology, and pharmacogenetics. So these are the different subjects which are involved under pharmaceutical sciences, okay, or the subtopics under pharmaceutical sciences. And the weightage for pharmaceutical sciences is 25%. Okay. Then the third and the most important one is pharmacy practice, which carries around 50% weightage in the examination. Okay. So 50% weightage will be for pharmacy practice. So far, like the previous thing that we have seen here, up to biomedical sciences and pharmaceutical sciences, they carry around 40% weightage. Okay. Then the next 50% weightage will be for the pharmacy practice. Among the pharmacy practice, they have divided into two subcomponents. One is the clinical sciences, and the other one is the professional practice sciences. So clinical sciences will carry the highest weightage, 35% weightage. Okay? And in this clinical sciences, the main part, that is the therapy part, will be included. Okay? So therapy part is nothing but here, again, it is considered as an integrated one, like pathophysiology. Okay? Then lab test, what are the lab tests that are required, followed by the pharmacotherapy part. Okay? So this is how, if we study from physiology part, like let's say, for instance, if we start the physiology of nervous system, okay, or the cardiovascular system. So we'll start with the cardiovascular system. At first, we'll study the physiology and the pathophysiology, and then followed by, in case if there are any laboratory tests that are involved, so we'll also study about the lab test. For instance, if it is a myocardial infarction, okay, so in case of myocardial infarction, which lab test is to be done? Okay? And in case of congestive heart failure, okay, so which value gets elevated? Okay, so like BNP and so on, all these things that we'll study at first, like integrated, like at first we'll go through the physiology, that is the pathophysiology, then lab test involved. And then we'll study about the pharmacology. That is, what are the complete drugs that are involved for the management of the myocardial infarction, or for the heart failure, or angina. So we'll study about the complete classifications, followed by applied therapeutics. So in applied therapeutics, what we'll do is we'll provide you the case scenarios. So we'll give you the cases, and according to the case study, so we will apply whatever the knowledge that we have studied. Okay, so we'll apply and we will select the appropriate medication for that particular condition. Okay, so in case of heart failure condition, for instance, if it is a heart failure, already the patient is on two drugs, that is the combination of both the ACE inhibitors and beta blockers. Okay, then in order to optimize the therapy, so what is the next step that we need to do? Okay, so in pharmacology part, we'll study only about the classifications. Okay, but here we'll start applying it. Okay, in therapeutics, we'll start applying it. Okay? So after, as I mentioned, that if the patient is already on both the ACE inhibitor and the beta blocker, now to optimize the therapy of the patient, so what is the next drug that we need to introduce? Okay, so or which drug will provide more cardioprotective property in case of the heart failure condition to the patients? Okay? So in this way, our method of teaching is always integrated, okay, so that it becomes much easier for you. So once we start the one systems, like cardiovascular system, so we'll finish all the components of the cardiovascular system. Like we'll touch the physiology, pathophysiology part, and then we'll also cover the pharmacology and pharmacotherapeutics. Okay, and at the same time, we'll also cover few other important topics like the patient counselings. Okay, So for important medications, so what patient counseling is to be done. So the patient counseling part also gets integrated. So everything that will finish in one topic. Okay. And at the same time, like in clinical sciences, we also have some health promotion and disease prevention topics and patient care process and nutrition and special populations. So these are the other things that are involved in clinical sciences. Then when it comes to professional practice skills, which carries 15% weightage. So in professional practice skills, like you'll be studying about the product preparation, that is the sterile and non-sterile compounding techniques. Okay, so what we do is we'll integrate this part with the microbiology thing. Okay, so where we'll be studying about all these things like different sterilization techniques and the compounding techniques and so on. And the next part is about the pharmaceutical calculations. So pharmaceutical calculations is, like, I can say that it plays a major role in any exam. So if we practice the pharmaceutical calculations, then it becomes easy to pass that exam. So either it is a Canadian exam, PEBC, or NAPLEX, or in CAPS examination, okay, Australian-based CAPS. So in all the examinations, like pharmaceutical calculations, they play a major role. Okay, so we should never skip the calculations, because when it comes to the calculations, they divide into two types. Okay, so one is the prescription calculations, which are involved here in professional practice skills, and there will be certain pharmaceutical calculations also involved. So in pharmaceutical calculations, like which consists of the half-life calculation as well as the volume of distribution and so on. So those things, they come under the pharmaceutical calculations. But when it comes to the prescription calculations, so all the calculations will be quite simple and easy calculations, like the dose calculations and such things will be asked under prescription calculations. So these calculations, like the prescription calculation, they are quite simple and easy. So if we learn those calculations, then easily we can do it without making any sort of errors. Okay, so I always emphasize the candidates to focus on the calculation part. So you should never skip. Okay, some candidates, they will be having a bit of phobia regarding the calculations, and they assume that, okay, even if we can skip this part, the calculation part, okay, and if we can focus on the other components, then easily we can pass it. But don't do such things. Okay? So try to practice the calculations, because if you practice the calculations, then easily you can do it on the day of examination. Then the other few components which are involved in professional practice skills are patient counseling, drug information, research methodologies, or the evidence-based decision makings. And you'll be also having the pharmacy law, ethics, and collaborative patient care. So all these are the other things which are involved in professional practice skills. Okay, so that is from the pharmacoepidemiology, which is nothing but the research methods and evidence-based decision making. So all these are the things usually overseas candidates, especially in India or in other countries. In case if you might have studied the Bachelor of Pharmacy, then in Bachelor of Pharmacy they won't include pharmacoepidemiology. Okay, so it becomes much difficult, and it is completely new for the candidates, those who have studied in India. Pharmacoepidemiology will be a new topic for them. Okay, unless if they have done the PharmD. In PharmD, it is a topic which is involved, but for Bachelor of Pharmacy, they won't be studying this pharmacoepidemiology part. Okay, so it's a new, completely new topic. So most of the times, the candidates, they try to skip this topic. Okay, but trust me, it is quite easy, and will make you it quite simple, much simple way, so that easily you can answer the questions related to the pharmacoepidemiology or pharmacoeconomics and biostatistics. So biostatistics is another topic, like it is there in the next component. So most of the candidates, they will try to skip all these topics, like the pharmacoepidemiology, as well as the pharmacoeconomics and biostatistics. Okay? And they also try to skip like molecular biology, biochemistry, okay, immunology, and this 15% weightage. So just they will study the physiology part and they will try to skip all the other components. Okay. So here in Canada, PEBC exam, like the passing percentage is 60%. Okay. So you need to score 60% in the examination. So what mistake that the candidates they do is they assume that okay, oh, and the 60% is overall 60%. Okay, so they won't ask you to score 60% in individual components. Okay, so here individual component is nothing but biomedical sciences is an one component, individual component. Okay, and it carries 15% weightage. Okay. So here they are not expecting you to score 60% out of this biomedical sciences, and they are not expecting you to score 60% out of the pharmaceutical sciences. The same goes here in the pharmacy practice. They are not expecting you to score 60% in pharmacy practice. Okay, and also in the last section, that is the social and administrative pharmacy. Even from that part also, they are not expecting you to score 60% from each component. Overall, from overall, altogether, you need to score 60%. Okay, so that's the thing for the Canadian PEBC examination. So you need to score 60% overall, but not in individual component. So that's what that's why most of the candidates, when they start preparing for the examination, so they will start selecting the topics. Okay. So they will look at the weightage, the topic weightage. So when they look at the pharmacy practice, they think that okay, 50% of the topics are only from pharmacy practice. Okay, so it means that if we focus mostly on the pharmacy practice, then we are covering 50% of the syllabus. Okay. And they will try to emphasize less on the minor topics like biomedical sciences or the pharmaceutical sciences. And also we got the last topic, that is the behavioral, social, administrative pharmacy, which carries 10% weightage. So here it will be pharmacy management, okay, pharmacy management and the Canadian healthcare system, pharmacoeconomics and biostatistics. Okay, so when overseas pharmacists, when they look at these topics, when they look at this behavioral, social, and administrative pharmacy sciences, so when they look at these topics, like pharmacy management, it is completely new for them. Canadian healthcare system, it is completely new for them. They don't know anything about the Canadian healthcare system. Then economics, like especially if they have done the Bachelor of Pharmacy, then they don't know about, they haven't studied about the pharmacoeconomics in the Bachelor of Pharmacy. Then biostatistics is completely new for them. So the candidates, they try to completely skip this 10%, okay, and they try to focus on other parts like pharmacy practice, which has got 50% weightage. And also from here, they will go in a selective way. So they try to select only pharmacology by omitting medicinal chemistry, okay, because they assume that only 3 or 4 questions, hardly 4 or 5 questions will be there from medicinal chemistry. So let's omit the chemistry part. Okay, so focus on the pharmacology and focus on some other like toxicology and biotechnology part. Okay, and in biomedical sciences, let's focus on the physiology and some medicinal microbiology and try to omit the other components. Okay, so this is how like most of the candidates, because I asked the candidates who were unsuccessful. So I asked them what the method that they have followed, how they have prepared for the examination. So they said that so most of the time, like we try to focus mainly on the important topics. Okay, then I asked them, what do you mean by the important topics? They told me that pharmacy practice is the important because it carries 50% weightage. Okay, and they said that like we completely omitted the last part, that is the behavioral, social, and administrative pharmacy. Okay, and a few other topics like we have studied from the physiology and pharmacology and toxicology and so on. Okay, so we appeared the examination and we were unsuccessful. So like I asked around 3 or 4 candidates who were unsuccessful. Everyone, they gave me the same answer, same sort of answer. So we focus mainly on the important topics. So here the candidates, they think that whatever be the weightage, they are looking at the weightage and they are thinking that, okay, 50% weightage means it is the most important topic. So we need to study, emphasize more on the pharmacy practice component. Okay, so we can omit this 10%. It doesn't matter because we need to score only 60 out of 100. So even if we omit this 10%, we still got 90% in our hand. Okay? So this is the major mistake that the candidates they do while they are preparing for the examination. Okay, so they need to focus on all the components. Okay, so because each MCQ is important, and the questions that they ask from the biochemistry or from immunology, microbiology, or even all these things which are mentioned here, the pharmaceutical sciences, from the pharmaceutical sciences, and also from the last component, that is from behavioral, social, and administrative pharmacy. So all are like straightforward questions that they will ask. They won't try to check your deep knowledge or the thorough knowledge from these topics. Okay, so statistics, biostatistics, simple things that they will ask in the biostatistics. Okay, so which type of the test that we need to apply, and in pharmacoeconomics as well, in Canadian healthcare system. So once if you study, then easily you can, by looking at the options, easily you can put the answer. Okay, so always at Elite Expertise, now we have designed our course in such a way that, so we are emphasizing on each and every topic. Okay, so not only on pharmacy practice, of course, pharmacy practice is the most important one. So we will discuss in detail about each and every topic in pharmacy practice. Okay, apart from pharmacy practice, so we also emphasize on the other minor topics like biochemistry, from molecular biology, even though it is there will be 2 or 3 questions, but those 2 or 3 questions will decide the candidate's fate. Okay, so that's why, so we'll be emphasizing on each and every topic. Okay, so even on the minor topics, so we'll be emphasizing on them to make sure that the candidates can cover all the things. Okay, and they can easily clear this examination in their first attempt. Okay. So here I can show you the overview of the target topics. So as we know that 15% weightage will be for biomedical sciences, 25% weightage for pharmaceutical sciences, 10% weightage for behavioral, social, and administrative pharmacy, and 50% weightage for pharmacy practice. So from pharmacy practice, even though it has got 50% weightage, hardly we can try up to 30%. When the candidate, they appear the examination, they can score up to 30%, or hardly they can go up to 35%. It means that the remaining percentage, they need to get it from the other subjects. Okay, so always I advise you while preparing, so we need to emphasize on the other subjects as well. Okay, so from pharmacy practice, once again, though like in therapeutics, so even though if we emphasize more on the therapeutics part, so while preparing, so on the day of examination, like there is a chance that we'll still commit the mistakes. Okay, and we made the candidates, they will put the wrong options. Okay, so that's why, to be on safe side, we also need to emphasize more on the other topics, like even in the behavioral, social, and administrative pharmacy, which carries only 10%. But still, if we can, once if we prepare all that topics well, then it's easy that all the 10% questions that we can easily answer in the examination. Okay, so I advise, like, at least if we can score like 30% from pharmacy practice, then the remaining 30 or 35%, the target should be 35% from the other subjects, then it will make up to 65%. So 60% is the passing percentage. Okay, and if you score up to 65%, then always you will be on the safe side. So at Elite Expertise, we guarantee you, we provide the guarantee that you will, like, we will cover all the components, like all the subjects in a simplified way. We will explain you in a much simplified way, so that it becomes much easier for you, and definitely you will clear the examination in your first attempt. Okay. Then regarding the references that we use are, so we use all the standard textbooks. Okay, so all the standard textbooks in preparing our content, in designing all our content, we use all the major textbooks, the standard textbooks. We refer the standard textbooks, and also we refer the standard guidelines. Okay, And we also, the major one is the Canadian Standards of the Drug Monograph, that is CPS, is the important one that we refer, the CPS. And also we use the up-to-date. Okay? So these are the major ones that we use to prepare our content. It means that once you get enrolled with the Elite Expertise, it means that you need not to open any other textbooks. Okay, so most of the times the candidates, they will keep on asking, like they will be worried about, so do we need to prepare from any other textbooks? Like, do we need to go through Sharjal or any other books and prepare some topics from them? So always I suggest them not to do that, because we are taking the full time to refer each and everything. So we will refer each and everything, and we will update our lecture notes and our content. So it means that you need not worry about those things. So if you emphasize mainly on our lectures, the live lectures, and also our mocks that we provide to you, and the handouts, we'll provide the handouts to you as well. Okay, and also we'll provide the assignments. Okay, so if you work out on all these things, then you will get a thorough knowledge, and you will develop all the concepts in your examinations, for your examination, and easily you can apply those concepts in your examination. So these are the references that we use, and always I recommend the candidates, I will suggest the candidates, you need not to go through any further references. Then regarding the examination pattern for evaluating exam, that is the first part of the licensing examination. So it is completely MCQ based exam. You will be having 150 MCQs. Earlier it was 200 MCQs, but now they have reduced to 150 MCQs. And the duration is 3 hours. Approximately it will be around 3 hours. Earlier it was 200 MCQs with 4.5 hours time, but now they made it to 150 MCQs with approximate time of 3 hours. Okay. And this examination will be conducted by the Prometric. Okay. So Prometric, and the advantage for this examination is, especially for those who are in India and in other countries, so you can do, like, you can go for a remote proctoring system. Okay. So remote proctoring system in the sense, like, you can sit for this examination from your home itself. You need not to go to the examination center. So just you can do it from your home. Okay, by sitting from your home. So you need to have the webcam as well as good internet access with your computer. Then you can do it from your home itself. Okay, so it means that earlier, like back in 2019 till 2019, so for anyone to sit for this Canadian PEBC examination, the candidates, they have to travel to Canada. So they have to travel to Canada to sit for this examination, or they have to travel to London. So these are the only 2 places which were available to sit for the PEBC examination. So, but post-COVID, what they did was, like, they started doing this remote proctoring system, and still now the remote proctoring system is available. So you can do it from your home country by sitting in your home. Okay, so that's the best thing regarding this Canadian PEBC examination. And in the examination, you will be provided with the online calculator and a formula sheet. Okay, so you can use that calculator and the formula sheet. So I can show you here. And before showing that calculator and the formula sheet, so here there are a few other points that I would like to highlight here, because most of the candidates, they have texted me and asking, is there any negative mark in the PEBC? So there is no negative mark for the PEBC examination. So if you score, like, if you give the correct answer, then you will get 1 score. If you give the wrong answer, then you will get the 0 score for that. But there is no negative marking for PEBC examination. Okay, and you will be having 150 MCQs. So you can answer all the 150 MCQs. Okay, even though if you are not sure about the answer, but you can still put the answer, because there is no negative marking. So you can guess the answers and you can put the answers. Okay, because there is no negative marking, so you need not to worry about it. Okay, and on the day of the examination in the Prometric, like, you will be provided with the formula sheet. Okay, so this is the standard formula sheet. Like, you can use this formula sheet. Okay, so where you can use to calculate the T-half as well as the volume of distribution, clearance, and by using the Henderson-Hasselbalch equation for the acids and bases. So all these things are the basic calculations. So you can are the basic formulas that you can refer them. Okay, you can see these calculations on the screen. Sorry, you can see this formula on the screen. Okay, and at the same time, in order to do the calculations, so we need the calculator, and in Prometric, they will provide the calculator. There is the online calculator will be provided. The scientific calculator will be provided, and this is how the scientific calculator it looks like. So they will provide it on the screen, so you can use this scientific calculator. Okay, so the exam, it will be on the same day. Sorry, it will be on the single day. Okay, and the pattern will be like, it consists of 150 MCQs, and you need to answer all the 150 MCQs. So there is no negative marking, and you need to do the 150 MCQs in 3 hours. And during the examination, you can use your reference formula sheet, as well as they will provide the online calculator. Okay, so these are the things that regarding the syllabus and so on for the PEBC. So now the next part is about the strategies for preparation. Okay, so what are the strategies that we implement at the Elite Expertise to teach you to clear this PEBC examination? Okay, so before going to have a look through the strategies for PEBC examination preparation, okay, what strategies that we follow at Elite Expertise. So I just want to invite Harika ma'am to come over here, and she can give her brief introduction. Okay? And after her introduction part, then we'll continue with this strategies, what strategies that we follow at Elite Expertise to make sure you clear your examination. Okay? So I would like to invite Harika ma'am.
Hello guys, hi everyone, nice to meet you all today. I'm Harika. I think Ritika knows me. I've been his teacher for CAPS exam, and he's got an ambition for Canada these days. Surprises me, Ritika. So, how are you?
Yeah, good, ma'am. Very good. Yeah.
Yeah. So, I'm a consultant pharmacist in Australia. Uh, in Australia we've been like striving our best to explore the pharmacy practice and reach the quality of United States of America, where we have implemented like EMR, electronic medication record systems, and like hospital-wide reporting, pharmacist interventions, and specialized pharmacist roles. So I've been involving in all that since 2018, and I'm myself working currently in Children's Hospital and Victorian Hospital. So we've been having a good exposure to Australia has always been striving for that quality in the pharmacy practice and prescribing rights approval for pharmacists worldwide. It has been a supporter, and we've been implementing the same here. So we've started Elite Expertise to impart quality pharmacy education at affordable cost. And we've got a huge, massive success in CAPS, Knowledge Assessment of Pharmaceutical Sciences for Australia. And now we've started this batch for PEBC for Canada, which helps you with the main motivation to deliver a quality education for you to help clear the exam in the first attempt and like move forward in your further steps to practice as the pharmacist in Canada. And definitely, like when I was having the chat with one of the colleagues in Canada, she was telling that they were like, pharmacies are hotcakes in Canada. Yes, it's a bit striving process, but if you clear all the licensing exams, it's very easy for you to become a pharmacist. And like employers are giving offer letters straight away, conditional offer letters. So there has been a wide scope, and definitely because it's a part of Western practice, similar practice guidelines everywhere. I've been going through the legalities, ethical principles of which you have to study for PEBC Canada. And I was so surprised how the schedules of medications in Australia are very much similar to Canada, like schedule medications, S2, S3, S4, S8 medications, all the law, federal law, state law, territory law. So it's very much similar practice. So we are really excited, and I'll be one of your teachers teaching autonomic pharmacology, biopharmaceutics, kinetics, therapeutics, calculations, like a mixture of them. And we've got a colleague of us, so must have introduced her to you. So it's a promise. So if we take a project, if we take a lead, or if we take something, an ambition, we would strive our best to deliver the best quality we can. And hopefully you'll all enjoy the sessions, same as CAP students did for us. And definitely it's going to be a very fruitful attempt. And thank you for trusting and believing us. And if you have that passion of, exposing yourself to the Western pharmacy practice and a goal to become a Canadian pharmacist, definitely this would be a right platform for you. And we promise to strive and give the best education, which is more functional in nature, which help you apply your knowledge in practice and help really patients make a meaningful impact in their lives. And explore to the functional roles and like specialist practice roles in the pharmacy practice. So we will strive our best to give you everything you need for the exam, like following the strict guidelines of Canada, CPS, etc., and updating the content every time, and best faculty. So sir and I would be teaching you, co-teaching along with the other faculties involving, because we are involved in CAPS as well. So we've got Canadian practicing pharmacists, registered pharmacists as the colleagues teaching you guys. So I'm sure it's going to be a wonderful, we are going to get a wonderful result soon with this long-term preparatory course. And I'm so excited to welcome you all to Elite Expertise. Definitely, it's a safe platform for you, a trustworthy platform where we speak and we are very transparent on what we think. And all our students are like our family. Like once they clear the exam, they become our family. And like we have a classroom approach where we've got like group of students helping each other, etc. Clearing doubts and co-helping each others to help the clear exam in first attempt. So it has been amazing, fun-filled experience, and it would be the same even though you have a gap in knowledge, gap in practice. Definitely we'll strive our best to brush up all your basics from fundamentals and help you help make a PEBC a cakewalk journey for you. I know PEBC is the toughest exam, Not everyone teaches PVC, so we'll strive our best to make it as easy and palatable as possible for you, for your future endeavors in conquering PVC. Thank you so much. So just I would like to say hi and then welcome to Elite Expertise family. And I'm sure you will love us and we'll love you too. And it's going to be a very good, like, mutual cooperative achievement, which we are going to see very soon in the form of result. All the best, guys, and we'll soon meet in the class. I'll give this to Arik sir. Sorry for a short pause, but we will talk more in the classes. Okay. Thank you, guys. See you soon. Bye.
So that's the message or the information from Harika ma'am. And now I would like to share about the strategies for preparation. So like what things that we implemented the Elite Expertise to make sure the candidates they clear the examination in the first attempt. Okay. So I'll quickly go through them. So here, in order to clear the examination, the most important thing is that always we request the candidates to attend the live lectures as much as possible. But again, even in Canada, like you can see that there are different time zones. Okay, so it may or may not be feasible for all the candidates to attend the live lectures. But whenever it is possible, so you can try to attend the live lectures. But anyhow, we have the WhatsApp group. And if you have any questions, like all the lectures, when once they after finishing the live lectures, all the lectures will get recorded and the lectures will get saved in the app. Okay, in the Elite Expertise app. So you need to log into that app and you can have through that lectures. Okay, so all the lectures will be saved in the app. And it means that even if you can't attend the live lecture, later on you can go through that recorded version and you can have a look through that recorded lectures. And if you have any queries or any questions regarding when you are watching that recorded lecture, then you can text us in the WhatsApp group. Then we will be giving the reply in the WhatsApp group. Or if you are available for the next live lecture, then you can just ask the question after we finish the live lecture. Then the next thing is, like, we always like during revision sessions, like before revision, we'll give some pre-learning modules. So you need to be prepared, like you need to go through all those pre-learning modules and prepare for those pre-learning modules before you attend the revision lectures. And we will be providing the assignments to you, and you need to finish all the assignments on time without any sort of delays, because once you do these assignments, you will get more familiarized with the topics. Okay, especially for the PEBC, the syllabus will be vast syllabus, so you need to keep on practicing a lot. Okay, so every day, like, you need to keep on revising the contents and watching the lectures, repeatedly watching the lectures, and also doing the assignments that we provided to you. Okay, and at the same time, we also have the mocks. So you need to do the mocks, and you need to repeat doing the mocks as many times as possible, okay, so that you will get more familiarized with the mocks, okay, and the type of the questions as well. Then, so we also provide you with the handouts, and these handouts will become a quick reference for you. So you can quickly go through all the handouts, like what are the things that we teach in the live lecture. So the important points, all the important points will be covered in the handouts. So you can quickly refer the handouts. It becomes a quick revision for you. And also we'll we will implement the team push activities like what we are doing for the Australian CAPS examination. The same thing that we'll also going to do for the Canadian PEBC examination. So we are going to implement the team push activities, like where all the team members will be involved, and each team member will motivate the other members to finish their assignments, to finish their mocks, and so on. Like there are different activities that are involved. Like once we start the once you log in through the app, okay, and once we start taking these live lectures, then you will come to know about all these activities. Okay. So all these are the things that to make sure that you will remain in practice, like every day you will keep on learning the things. Okay. And if you keep on doing these assignments as well as mocks, and also we ask you to collect the keywords from each topic. Okay. So those keywords that you need to keep on submitting to us. So if you keep on doing all these things, then you can remember on the day of examination. It becomes much easier for you. So on the screen, when you see the question on the screen, then easily you can answer the question because you have been practicing. So all these are the strategies that help you to practice a lot. Okay. And as you practice a lot through these strategies and through our team push activities and so on, then it becomes much easier for you to crack this examination. Okay. Then this is our Elite Expertise app. So in Elite Expertise app, when you log into the app, so you will be provided with the app access. When you log into the app, so you can see like different icons up over there, like preparing for the PEBC exam, preparing for the CAPS exam, preparing for the Australian Pharmacist intern and written and the oral examination. So you need to go through the PEBC. You need to select the PEBC icon in the home page, and from there you will be directed. So you'll be directed to the lectures, as well as you'll be directed to the assignments folder, okay, as well as the other things that what will be the team push activities that we implement. So all those things, like you will be directed when once you click the PEBC exam icon. Okay, so you'll be provided the access to the PEBC pathway. Okay. So this is about the Elite Expertise app. So you can use the app in your mobile as well as in Windows. So we have both the versions, that is the on the Windows as well as on the mobile version. And all our mocks will be on ProProfs. Okay, so on ProProfs you can go and do the mocks. Okay, so we will let you know when once we finish the topic. After finishing the topic, then we will release the mock. Okay, and that mock will be ready in the ProProfs. So you need to go and do your mocks in the ProProfs. So we'll provide the access to the ProProfs as well. So you need to so ProProfs, like there will be a separate for the CAPS as well as separate for the PEBC. So you will be given the access for the PEBC ProProfs, okay, section, and you will need to log into the ProProfs in the PEBC section, and you will be having the mocks up over there. Okay. Then, so these are the few things that I would like to brief about Elite Expertise and so on, like the examination syllabus and how we train you to clear this examination, and also regarding the Elite Expertise app and the ProProfs where you can do the mocks. Okay. And the strategies that what you need to follow to clear this examination. Now is the time to introduce our team members. So our team members will help you a lot, like in case if you have any issues, especially in logging to the app, or because most of you will be new to this app. Okay, so our team members will be always, they will be ready to support you. So if you have any issues, so you can talk to our team members. You can message in the group, in the WhatsApp group, then one of the team members will reply to you immediately. Okay. So at first I would like to introduce our admin manager, Ashita Bhimavarpu. So she's our admin manager. So she will look after all the Elite Expertise, all the major things related to the launching of the programs and so on. So Ashita is here. So hi Ashita, can you just, yeah.
Hi everyone, I'm Ashrita. I guess I've just introduced in the starting. I'm working as an admin manager of Elite Expertise. So, we are a team of 11 members who will be helping you for each and every case from starting to ending, from onboarding you to helping you in each and every task. As we have shared earlier, we are an online education platform which will be helping the pharmacist to make your pharmacy journey, like provide you the landmark in Canada. We have the resources which we provide is the mock, the lectures, live lectures, mocks. We have the study materials, everything. We are of a team 11. One is Sri Subatsan. He's a content developer. He's a main website developer who will be helping you in the technical challenges and everything. We have Neha, Riley as well, who are the main assets to the team. Glory, who will be helping you from starting to the ending. We have Sahana, she's head of quality manager. She'll be providing all the quality resources. We have Jilani, Riley, Ashutosh, who will be providing you all the app related issues. So we are just a call away, we are just a message away. If you have any other queries, we're always there to help you out. Just drop a message to us. And sorry, there is a power glitch in India. I stay in India, Hyderabad. There is lots of rains flooding over here. So there is a mixed match of background over here. And let me congratulate each one of the pharmacists for choosing Elite Expertise as your pathway for cracking PEBC exam. I'm sure whatever the result we have in CAPS, within 1 year to 1.5 year of span, we have got 800 students, 740 CAPS qualified students, and 20%, more than 30% are working interns in Australia. So we do respect Arif sir and Harika ma'am for giving this excellent coaching. And I'm sure all the candidates who have enrolled for PVC course will be having the same. Thank you so much, Arif sir. I guess I've taken so much time.
That's all good. Thank you so much, Ashita. Okay. And our next team member is Sahana. So actually, Sahana is not here today. But Sahana is the quality control manager at Elite Expertise. So she's the one who will be looking after like all the aspects, like especially for PVC. Her responsibility is like she will be guiding you regarding for each provinces, like what are the requirements, So PBC is the common exam. So after clearing the PBC examination, so what are the things that are to be done, and what are the each province requirements? So everything, all the information. So she will be providing it to you. Okay. So later on, like after clearing this first evaluating examination, so all the other information, to provide the other information, Sahana will be with you. Okay. Then we have Really with us. So Really is one of our team members. So she has cleared her CAPS examination back in November 2023, and she is one of our team members. And in case if you have any issues like to while enrolling or to any app related technical problems, okay, so you can just contact Really as well. So hi Really.
Hi, sir, and thank you for the introduction. Welcome all to Elite Expertise. I'm happy that you all joined Elite Expertise. I know that you people are still confused whether your decision is correct or not, but I'm 100% sure that you all are going to do great, and definitely you will achieve your success. And I really trust ma'am and sir so much. They will definitely help you. And other than that, if you need any help, I will be there, and other team members will be definitely helping you. You can definitely contact us whenever you need. Welcome all, and thank you. Thank you so much, sir.
Yeah, thanks Really. And we also have Neha with us. So Neha is also one of the CAPS qualified candidates. So she's also one of the students coordinators. She will be helping you out in if you have any issues regarding the app problem or any thing. So you can just contact Neha as well. So hi Neha.
Hello, sir. Good evening.
Good evening, Neha.
Hello, everyone. This is Neha from Elite Expertise, currently working as an admin manager. And welcome you all. This is a good decision you have all made to crack your PBC. as we all know, PEBC is the toughest pharmacy board exam, compared to all the countries. We all know that it's the very toughest. I would like to I would like to suggest to travel with ma'am and sir, and just study what ma'am and sir says, and they will guide you, and they'll hold your hand until you clear your examination. Trust them, and all the best for future endeavors. And we are all here to help you, and we are all committed to support you. Please feel free to reach us in case you have any kind of issues or something. We are all here to help you. Thank you, sir.
Yeah, thanks, Neha. And we also have Sri here. So Sri is one of our main technical support person. So he also qualified the CAPS examination. So he's also one of our team members. And he's the main person who looks after all the technical issues. In case if you have any problems, then you can also contact Sri as well. So hi, Sri.
Hi, sir. Thank you for the nice introduction. And as sir mentioned, I am the Sri, and I'm from Sri Lanka. So if you have any technical issues or if you want any support, you can anytime connect me. I will be there. I will help you. And you have chosen the PEBC with elite expertise. I am so happy, and I have so confident you can crack this exam. It's a long journey. It's a 6-month journey. So please don't lose your hope. So as I am a CAP student of sir, I know how ma'am and sir's teachings are so good. So just stick to ma'am and sir. Definitely you can crack the exam. So all the best for your future. That's all my side. Thank you, sir.
Thanks, Sri. And for any other technical issues, we also have got especially for the app related things. So in case if you develop any technical problems in the app, we also have Vikas with us. So he's mainly dedicated for this app to rectify the app related problems. Okay. So in case if they arise, and also you have the pro props as well. So to do the mocks in case if you have any issues in the pro props. So all the team members will be there to support you, and all the team members will be there to, they will respond you immediately. So whenever you have any issues, then just you can message in the group, then the team members will be ready to help you out. Okay? So we also have the other team members with us, like Ashutosh is there, and Hira, and Glory is there. They all are our students. Jilani, and we also have we also have the other team members. Okay, so they all are here to support you in case if you have any problems. Then definitely you can reach out to them, and they will help you out in sorting out any sort of the technical problems or any things. But myself, ma'am, and Shama. So we three are the main lecturers. So we help you in teaching all the content. Okay. So myself and ma'am, Shama will be teaching the pharmacy management and mainly the Canadian healthcare system and all those things, including with some of the pharmacotherapy part. Okay. And I will be teaching the pharmacotherapy with the integrated physiology, pharmacology, and also some of the biomedical sciences part. Okay? So I'll be taking the biomedical sciences, and I'll be taking that biostatistics, pharmacoeconomics, pharmacoepidemiology, okay, along with the main core part, that is the pharmacy practice part, that is the pharmacotherapy part. And Harika ma'am will be taking mainly about the pharmaceutics and calculations. So she's expert in calculations. So she will teach you in such a way that you will never forget the calculations in your life. So she will be teaching the calculations, pharmaceutics, and some toxicology part, and some of the components in pharmacotherapy as well. Okay. So that's it from our side. Thank you so much. And in case if you have any questions, then feel free to ask us. So, well, even later on, if you have any questions, then you can just text to one of our team members, or you can just text directly to me on my WhatsApp, and we'll be happy to give the answers to your questions. Okay. So once again, I would like to thank everyone for watching this live live event of our PEBC orientation, and I would like to congratulate all the candidates, okay, the first batch of the PEBC with Elite Expertise. So, and as you have selected the Elite Expertise, as you have chosen the Elite Expertise for your PEBC pathway, so we will make sure that 100% you will clear your exam in your first attempt. Okay. So thank you so much, guys. Thanks for choosing Elite Expertise, and I'll catch you soon in the live lecture. Okay. So thank you.
Thank you, sir.
Thank you very much, Harik sir. That's very insightful. And guys, we'll be sharing the schedule of the classes as well. Stay tuned, guys. Bye bye. Take care.
Thank you.